What have we got here?
Now, Sia from Deriski, so you are doing the Enlighten Whitening treatment, is that correct?
I am indeed.
Okay.
It's a very novel treatment in the sense of its ease of use, its practicality, and a very straightforward instruction for patients. And the fact that they need to wear these trays, which is a very low concentration, steady uptake of the actual bleaching trays, and the patient needs to wear it for 2 weeks to get the most optimum guaranteed results. And that's what's the beauty about this, in the sense that not only is it a guaranteed result, the whitening works, and there's also a very straightforward, simple maintenance program to ensure that you don't just get a whitening result as a quick fix, but it also lasts and is maintained.
Great, and you've got Annie here. So she's had the treatment?
She's had the treatment.
Okay.
She's been using the trays, I believe, for a couple of weeks, and we've managed to get to this wonderful B1 result. If you want to smile for us, Annie.
Yeah, we'd love to see how it works. They look great, huh?
Thank
Do you love it?
I love it. It's very good.
Do you want to show us how the actual tray works, Annie?
And as you're explaining, you were saying to me that a lot of times the fact that this fits so uniquely and that normally it won't cause the problems even if you have it on for 2 weeks or you have it on overnight?
Indeed. The way that the actual tray is designed and the way that the gel arrives in a cold, fulfilled manner, it allows the minimum sensitivity. You don't tend to get the usual issues regarding sensitivity which most gels tend to have. It also allows a very slow uptake, and the design of the tray allows for the gel not to actually spill out of the tray and the saliva to get in, so therefore you tend to get that great result from the neck of the tooth right down to the tip, which is a uniform white result, which is what patients are really looking for.
And what about the regression?
The regression is a big question, because a lot of patients will go and have teeth whitening as a quick fix stop, but then 2 or 3 months down the line they'll come back to your practice and they're not as impressive. The beauty about this treatment is it will rely on very straightforward patient compliance to wear it for a couple of weeks, and they need to maintain it by wearing the tray for 1 night every other month.
That's amazing.
I have some patients that insist on wearing it once a month, but that's down to the actual patient's preference. So the maintenance becomes much more affordable, and the actual result is much more maintained.
Now, see, I've had teeth whitening done on a different system, but especially for men, I don't know why, but I always struggle to remember to use the retainers and top up. But I was quite sensitive. Does it depend on what patient is having the whitening, whether your teeth are going to be more sensitive?
I think there's about a 90% group of patients that tend to have minimal issues. Okay. If you're outside that bracket, it's very important for patients to have gone to a proper dental practice. They need to have a full assessment by a dental practitioner to ensure that if there's going to be any issues, so those are then looked at and dealt with appropriately.
Great. I mean, you would love some
I
more whitening.
I
We
know.
all
I want
like
every
some more
single
whitening.
one of these treatments.
That's brilliant. Thank you so much.